The House has passed President Trump's sweeping mega bill, a multi-trillion-dollar package filled with tax cuts, spending changes, and some of the biggest federal safety net reductions that we've seen in decades.
And supporters say it's a bold move for America's future. Critics argue it's devastating for working families and rural health care specifically. So joining us now live in studio is Will Humble, Executive Director of the Arizona Public Health Association. Thank you for being here this afternoon.
Yep, my pleasure.
We have a lot to get to, but we want to start first with Medicaid cuts. So how is this going to affect Medicaid services and specifically the older Arizonans using those services?
So you've heard a lot about what the cuts on Medicaid. There's a few areas that's going to happen. The first impact is going to be what's called work requirements for Medicaid members that are able-bodied adults. So that's people between 13 years old and 64. So they would be expected to go to their state Medicaid agency and report online, I don't know how they're going to do the reporting, and say, prove I'm in school or I'm working, and these are the hours that I'm working. And the people between 13 years old and 64 are, when this gets implemented in late 2026, they'll have to do that in order to keep their Medicaid insurance. Now, a lot of people think, well, they should just get off the sofa, and people who won't get off the sofa, good that they don't have their health insurance.
That's probably a pretty generic way of looking at it.
I've heard them say it over and over. But really, the way people get kicked off Medicaid in a system like this, and Arkansas already did this a few years ago, is people are unable or don't know how to report their school or work, and then they get kicked off Medicaid, not because they don't meet the work requirements, but because their state made it difficult to report the actual school or work.
Yeah, so a little educating on that end. Okay, let's talk about beyond the health cuts. Some people think that this is really a statewide economic risk. We're talking hitting hospitals, rural clinics, small businesses, and state tax revenue. Will the impact really be that severe, though?
If you take what's here on paper, I think, yes, it will be severe. Just as severe as that? Not today. So one of the things they did with this bill is they give everyone the tax relief today. Right?
Which is the upside. So let's talk about that, if that's the silver lining.
And the pain, if you're wealthy, it is.
Sure.
The pain is kicked down the road. So the work requirements at the end of 2026, the reduction in the provider tax that Arizona uses to draw down the federal funds, that's cutting in 2028. So when those things happen in 2028, if they do, then that's when all that rural pain would happen. And it's because directly of what's called uncompensated care, especially in rural Arizona. Well, why rural Arizona? Because there's twice, percentage-wise, there's twice as many people on Medicaid in rural Arizona than urban. In urban Arizona, it's only 17% of people on access or Medicaid. Rural Arizona, it's 38%. So those hospitals have a lot more exposure to people that will become uninsured as these measures kick in between now and 2029.
Yeah.
And you touched on it just briefly here with the EVs while we were talking. So the plan also ends tax incentives for the green energy, the power plants, homeowners, and car buyers. So what impact is that having, the two biggest impacts on sustainability?
That's immediate.
Okay.
So at the end of September, if you wanted to put rooftop solar on, you used to enjoy a 30% tax credit for that. That's ending September.
Okay.
This year, September.
Sure.
The EV tax credit ends in December. That's a $7,000. And if you're a business who wanted to invest in EVs, that ends at the end of this year too. So the EV, they were adamant about getting rid of the clean energy parts of this, and so they did it exactly this year. The Medicaid pain parts, they kicked down the road. Whether they ultimately happen or whether a future Congress undoes those, or a future administration, a lot of these things are after he's gone.
Well, and that's what you had mentioned, like 2028. So the new administration, whoever that may be, can come in and maybe reverse course before some of this stuff takes effect?
Yes.
Okay. So.
And you know what, one more thing, you argue that those incentives, they would drive up the cost of electricity for a lot of homeowners over time, but why wouldn't it actually lower the cost? And really, because the utilities may be getting the cheapest kind of energy without needing to worry about renewable requirements.
Well, right now they're enjoying that tax credit for investing in solar, which builds their capacity for solar in the future, which doesn't require a fuel like natural gas, for example. So when that tax credit helped them provide the capital investment to get us to a more sustainable and cheaper sources of energy that don't require fuel like natural gas does. So over time, they expect this will drive up electricity prices. Now, That's happening already. APS has already put in for a 15%
We've all seen it in our bills.
rate increase. They already asked for 8% 2 years ago. So the bills keep going up. And that's another thing about all of this stuff is that higher electricity bills hit poor people the hardest. Medicaid cuts hit poor people the hardest. Poor people are not benefiting from the tax cuts. So it's lower income people that are suffering point by point by point by point in this.
Well, we appreciate your insight. And because this is so expansive, it's going to impact so many people. 12 News journalist Joe Dana is working really hard on the specifics on how this is going to impact people here in Arizona. So he's going to have that story coming up on 12 News tonight at 6 o'clock. Will, thank you very much for being here. We've got an